real quick from the bottom, we got the toes, big toe up, 4 toes down, and then alternating. Then we've got plantar flexion and dorsiflexion at the ankle, inversion and eversion. At the knees, we've got flexion and extension by driving the knees forward. Then we can go side to side. At the hip, hey everyone, thanks for tuning in. Steven here with Team Euphoric, and today I'm joined by Michael from One Body, and today we are going to be sharing with you the top 5 mobilization exercises for low back pain. And even though I'm saying top 5, it's actually more than 4 mobilization exercises. We're going to be focusing on 5 body areas. We're going to start from the ground and work our way up, and those areas are going to be the foot and ankle, the knee, the hip, the pelvis, and the lumbar spine. But without further ado, let's go ahead and get into the mobilization exercises. All right, so for these proprioception exercises, we're going to start from the ground and work our way up. The first one is going to be for the foot and ankle. With regard to the foot and ankle, we're going to be working on the toes and the ankle. And with regard to the toes, the main action of the toes are going to be flexion and extension. So what we want to do for the proprioception exercise, the mobilization exercise, is going to be big toe up and then 4 toes down. And you want to alternate between that. So it's big toe down, 4 toes up, and then you drop the 4 toes and you raise the big toe up. So as you can see, Michael doing it perfectly. Once we've done the mobilization for the toes, we want to move toward the ankle. For the ankle, main actions at the ankle are going to be flexion and extension. So we got dorsiflexion, which is pointing the toes up toward the sky, and then plantar flexion, which is pointing the toes down toward the floor. So you're going on your tippy toes, and then you're raising onto your heels. And then the other action at the ankle, aside from dorsiflexion and plantar flexion, is going to be inversion and eversion, or supination and pronation. With regard to inversion and eversion, you are pointing the soles of your feet toward each other, toward the inside, and for eversion, the sole of your feet is pointing toward the outside. So what you would want to do is alternate. So you are collapsing the medial arch for eversion, and then for inversion, you are raising the medial arch as much as you can. Next, once we've done that, we want to move toward the knees. For the knees, the main action is going to be extension and flexion of the knees. So you're going to bring the feet together, knees together, and you want to drive the knees as far past the toes as possible. And then you're just going to go right back into full extension of the knees by standing up. When you flex the knees, there's also going to be a little bit of rotation of the tibia that you can get out of there. So we could go side to side just to get a little bit of rotation in the knees as well. Once we've warmed up the knees, then we're going to move up to the hips. At the hips, the hip is a ball and socket joint, so it pretty much does every single range of motion that you could think of. First, we're going to be doing abduction and adduction. Abduction is when you bring your foot away from the midline, and adduction is when you bring your foot toward the midline. So you're just going to bring your hip out and across your body, and then you are going to bring it in and across. And that is abduction and adduction of the femur. Next, we're going to do flexion and extension of the hip. Flexion, you're bringing your knee toward your chest. Extension, you are bringing your foot back behind your body. And you're just going to alternate between flexion and extension. Next, we're going to get into medial and lateral rotation. You're going to bring your hip to 90 degrees. And then for medial rotation, you are bringing your ankle outside of your body. For external rotation or lateral rotation, you're bringing your ankle inside of your body, and you're just going to alternate between those. So this is the windshield wiper position. And then to get circumduction, we are going to do some figure eights with regard to the hip. This one right over here, when you do circumduction, it is basically a combination of all of the available motions in the hip. Once we've warmed up the hip, next we're going to move up to the pelvis. At the pelvis, the 2 main actions are going to be anteversion and retroversion and lateroversion. So with regard to anteversion and retroversion, anteversion is anteriorly tilting the pelvis. So if your pelvis was a bowl of soup, anteversion, you would be pouring the soup out in front of you. Retroversion is the opposite. It is when you are flattening out the spine and you are going into a posterior tilt. So if you had a bowl of soup and you were to do a posterior tilt, imagine that the soup is falling all over your chest. But that is anteversion and retroversion. And then for lateroversion, what you want to do is you are going to flex the knee to bring the ilium down toward the floor, and then you're going to go up on your tippy toes to bring your ilium up toward the sky. And that is lateroversion of the ilium. And then next, we are going to move on to the lumbar spine. The lumbar spine is going to be the last of the areas that we're going to be focusing on. The lumbar spine is responsible for flexion and extension. So what we could do to get flexion and extension of the lumbar spine is really focus on rolling and unrolling the lumbar spine as much as possible. A lot of people, when they bend forward, they are taught to keep their back nice and neutral and straight. The problem is if you always maintain a very fixed, straight lumbar spine, your body is going to get very, very rigid and stuck. your spinal column is not an actual column. There are tons of vertebrae. There are 25 vertebrae in the thoracic, lumbar, and cervical spine, and they are meant to go into flexion and extension. So you don't want to get used to constantly making it a fixed position. Next, we're going to get into lateral translations. For the lateral translations, arms out to the side, you're going to point your toes in, that way you could fix the pelvis, and then you are just going to shift from left to right, and that is going to create a little bit of space gliding side to side in the lumbar spine. This mobilization right over here, it's terrific, and it's something that not a lot of people incorporate, and a lot of people are going to be very stuck in this area. So definitely something worth incorporating into your routine. And then lastly, we are going to do the lateral translation with a side bend. By doing the side bend, not only are we moving side to side, but we're also going to be stretching out all of the musculature of the muscles in the lumbar spine that are responsible for maintaining that structure. But that is pretty much the lumbar spine mobilizations. So once again, real quick from the bottom, we got the toes, big toe up, 4 toes down, and then alternating. Then we've got plantar flexion and dorsiflexion at the ankle, inversion and eversion. At the knees, we've got flexion and extension by driving the knees forward. Then we can go side to side. At the hip, we've got abduction and adduction. Then we've got flexion and extension, we've got medial and lateral rotation, and we've got the figure eights to get the circumduction. At the pelvis, anteversion and retroversion. We've also got lateral version by bringing the ilium up and down on one side. At the lumbar spine, we've got flexion and extension by doing the roll and unroll of the lumbar spine. And then we also can do some lateral translations of the lumbar spine. And lastly, some lateral translations with a side bend. And there you have it. Those were our top 5 mobilization exercises for low back pain. Give them a try. You could do them every single morning when you wake up, or you could do them as part of your warm-up prior to doing your weight training routine. Give them a try, and it will greatly improve your symptoms of low back pain. And if you want a little bit more information, you could come to our seminar on September 18th. We're going to be going over the anatomy of low back pain assessments, and we're going to be going through a ton of exercises. But that's it for today. On Friday, we are going to be demonstrating some proprioception exercises. Specifically, we're going to be doing the top 5 proprioception exercises for low back pain. So be on the lookout for that. That's going to be dropping Friday at 2 p.m. But that's pretty much it for today's video. If you guys enjoyed the video, be sure to smash that like button so we know to continue making these types of videos in the future. And if you're either new to the channel or haven't subscribed yet, be sure to subscribe to the channel and hit the notification bell, as we will be uploading new videos every single day. That's it for today's video. Thanks for tuning in, and we will see you again tomorrow.